Congratulations on your pregnancy. In this upcoming video, we would like to review some genetic screening options that will be available to you to consider.
Let's talk genetic testing. During your pregnancy, you have the option to do testing to evaluate your baby's risk of certain genetic and structural abnormalities. Some of these tests evaluate the baby's genes, and some tests evaluate you and your risk of passing on genetic disorders to your baby. You may be interested in doing these tests if you would want to know more about any of these concerns prior to delivery, or if that knowledge may affect the management of your pregnancy. To evaluate whether your baby is at risk for chromosomal abnormalities, non-invasive testing, also called NIPT, is done using ultrasound and your blood. The risk of chromosomal abnormalities increases with maternal age. The most accurate non-invasive test is called the cell-free fetal DNA, which evaluates DNA from the pregnancy that is detectable in your bloodstream. This test is very accurate and greater than 99% sensitive and specific, meaning that more than 99% of cases are accurately identified with a low risk of false positive results. Cell-free fetal DNA testing can be done after 9 weeks of pregnancy. The test evaluates for trisomy 21, which is Down syndrome, trisomy 13, trisomy 18, which are more severe and more rare than Down syndrome, and sex chromosome disorders. You can also find out the fetal sex if you would like. Along with a blood draw, an early anatomy ultrasound is often done at 12 to 13 weeks to evaluate the early development of major organs. Typically, a second trimester blood draw called the AFP, or alpha fetal protein, is offered to screen for neural tube defects. Serum screening, or integrated screening, is a separate option for women under 35. It consists of a first trimester blood draw and a nuchal translucency ultrasound on the same day at 12 weeks, followed by a second trimester blood draw at 15 to 18 weeks. If the nuchal translucency is thickened, then the risk of an abnormality is higher. This test provides a risk assessment for trisomy 21, trisomy 18, and neural tube defects. It correctly identifies 95% of Down syndrome, but has a false positive rate of 5%, meaning the test can sometimes come back abnormal when the baby is normal. The final result is not available until after the second blood draw, which is approximately 4 to 6 weeks later than the cell-free fetal DNA test. If your non-invasive screening test comes back abnormal, we recommend meeting with a genetic counselor to discuss this option of diagnostic testing. This may include a CVS or amniocentesis to determine whether the screening test was accurate. For all patients, regardless of whether you choose to do genetic screening, we recommend a 20-week comprehensive anatomy ultrasound. This evaluates the baby's anatomy, fetal growth, placenta, cord, and cervix. We also offer genetic carrier screening, which is a blood test which evaluates whether you are a carrier of any recessive genetic disorders which could be passed on to your child. Carrier screening can be done prior to or during pregnancy. Both parents would need to be a carrier of the same recessive disorder for their children to be at risk. If you are a carrier, then we can test your partner. In the rare event you both carry the same mutation, the risk of the pregnancy being affected is 25%. Consultation with genetic counselors would help decide whether to pursue invasive testing to determine whether your child is affected. Because these tests are optional, they're not always covered by insurance. Out-of-pocket costs can vary. We've included a handout in your initial prenatal packet and online that will help you gather information about these costs under your particular policy. If you would like a referral to a genetic counselor to review your family history and risks in detail and help you decide about testing options, we're happy to facilitate this. Just let your provider know.
We know this can be overwhelming to talk about early on, but we'd like to give you the options and the information ahead of time so that you can refer back to this video and ask questions when you see your provider. Thanks for watching. Don't worry, we will review all of this again at your next visit. We look forward to seeing you.